As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
All right, welcome back to Your Health with Terrebonne General Medical Center, and as promised, Dr. Russell Henry, who is an internal medicine doctor. Doc, you've been doing this for 33 years, you said?
That's right.
And you still love what you do, you said?
Absolutely.
There you go. All right, tonight we're going to talk about hitting the gym and fulfilling New Year's resolutions, but make sure you're protecting yourself against common germs that tend to linger in those gyms. So first obvious question. Why do germs thrive in gyms?
Well, Martin, there's really two good reasons why germs are found in gyms. There really, if you look at it, there are two environments in the gym. One is the moist environment of the locker rooms, the shower stalls, and so forth. And that moist environment is a setup for bacterial proliferation as well as fungus to be grown. And the front portion of the gym, or the gym proper, is used by a lot of different people. And that's another reason why bacteria are spread from person to person, as you might expect.
Right. Now, the common diseases that lurk inside these locker rooms, can you give us an example of what they are?
Sure. They really fall into three categories. The funguses, which is the one that we read most about, has to do with athlete's foot, tinea cruris or jock itch, tinea corpus, or a fungus infection that can be throughout the body, and actually infections of the toenails. And the other part is the bacterial infections. Certain bacteria tend to proliferate back in the locker rooms. The fungal infections, which we see primarily, is of the feet, and it's very important to take care of the feet in the setting of the locker room, in that drying of the feet, applying proper drying agents and antifungal preparations to keep the fungus away is quite important. By the same token, using drying methods and antifungals to prevent other fungal infections like jock itch are important. I did mention before the fact that probably one of the worst things to get in a gym situation, a locker room situation, is human papilloma virus, which is a virus that causes plantar warts. Plantar warts, similar to the common wart, but once you get them, they're very difficult to get rid of, and requires very intensive therapy, which can be provided by several of the different physicians who practice at Terrebonne General, mostly the dermatologist. And finally, bacterial infections lurk also in the locker rooms, and there's certain gram-negative organisms that can cause abscesses, as well as gram-positive organisms like staph that you can pick up in the locker rooms as well.
You know, we've seen it in the news, Doc, a lot of times, even pro football players that get these major infections and all. But how do you prevent locker room germs? What can you tell us? How to prevent them?
Very important that to be careful while changing, showering, or walking by the pool. Never let your feet touch the floor. Even while showering, one should wear some sort of foot protection. Once the shower is taken, it's very important to wash and dry your feet thoroughly, and also it's probably important to use different footwear or socks with every change and to occasionally take those tennis shoes and throw them in the washer and make sure they're washed in hot water as well. It's very important to be very cautious about cuts, and it would be my strong recommendation that if you have an opportunity to shave before or after a gym workout, it's probably most important that you shave after, because cuts are a very easy portal of entry for infection. This, of course, applies to women too who shave their legs. Never use a towel that's touched the floor. Always dry, and if there is a break in the skin, be cautious to apply antibacterial preparations such as an iodine compound or something like chlorhexidine to the skin break to prevent infection.
So if you're going to the gym to look good and you're shaving before you go, that's the worst thing to do, right?
That's correct.
All right. We're going to take a break and hear from Terrebonne General Medical Center. When we come back, we have more with Dr. Henry. Don't go away.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
All right, Dr. Russell Henry is still with us, and we're talking about germs in the locker room and things of that nature. And Doc, I got to ask you, the most common diseases that lurking sounds like a big horror movie, but they do lurk. Diseases do lurk outside the locker room. What are they? Well,
The thing that comes to mind first outside the locker room in the gym proper, we're talking about bacterial infections. And the most common and the most feared, I suppose, is methicillin-resistant Staph aureus, which is almost epidemic throughout every community in this country. It's skin contact transmitted. There's certain other bacteria like strep and strep infections, and certain others like a few gram-negative rods that can also give you skin infections. And of course, there are the viruses that we spread on a day-to-day basis, which include the influenza virus as well as some of the common cold viruses.
What are some of the ways that I can protect myself or others could outside of the locker room?
Well, probably the most important thing is to try to assure cleanliness of the equipment as much as possible. It's not a bad idea to wipe equipment down that you're going to be handling before and after use. In any piece of equipment that you would be sitting on, it's probably a good idea to apply a clean towel before sitting on it. Those two things would eliminate a lot of problems. Another thing that would prevent the spreading of bacteria would be to change clothes immediately after the exercise and not wear the sweaty clothes after the workout outside of the gym because the sweaty clothes does tend to cause proliferation of that bacteria. While in the gym, it's probably important to be careful to not rub your eyes or your mouth with your hands. always use the back of the hands or the back of the arm, because those hands and your fingers are going to be touching and thereby spreading things around. Again, the thing we learned, sneezing and coughing. Always sneeze or cough in the back of your arm or the back of your hand, not the front.
Okay, very good advice. I've seen a lot of people do it. They work out when they're sick or under the weather. Can they work out when they're sick? Is that a good practice, bad practice?
Well, there are a couple of reasons why it's not a good practice. Probably the most important thing is if you're really sick, your body needs that energy to get better and not to be exercising. Although some people, as you know, are pretty obsessed with exercise, not me being one of them. But if you're sick, you probably shouldn't be exercising. If you're mildly sick with an upper respiratory infection, not having a lot of fever and so forth, it's reasonable to exercise a moderate amount, but keep it at home. Don't bring it to the gym and spread it.
Okay, very good. Now, pneumonia. We hear about it a lot, we talk about it a lot, but the dangers and risks that are involved in pneumonia, what are they?
Well, the statement I say about that is that one person's upper respiratory tract infection or cold may easily become another person's pneumonia. So it's very unpredictable who's going to get pneumonia, but generally most cases of pneumonia are transmitted from person to person. Over 3 million people in the country contract pneumonia per year. About 500,000 wind up in the hospital, and about 5% of those die. So it's nothing to be played with. It should be taken care of and should be attended to, particularly by a healthcare representative, such as a staff member of Terrebonne General Medical Center. You can contract pneumonia usually when your immune system is down, but all too often an otherwise healthy person, it's another person's cold that becomes your pneumonia.
And in just summarizing, I've heard you loud and clear, a lot of common sense stuff, right?
Absolutely.
So if people use their common sense, they can stop the spread of a lot of things, right?
Absolutely. I know a lot of people are obsessed, as we say, with exercising. There comes a time in which it's probably better not to.
All right. Well, certainly, Dr. Henry, we appreciate you being on the show, and thanks for the great advice.
Thank you.
All right. Now, what we're going to do now, we are going to go to the Canada's Kitchen, and they are serving up something. So when we come back from the break, we're going to join our crew in the kitchen to see what that Canada's crew has in store today. So don't go away.
Want to try this out?